So the dilemma about whether to measure patient satisfaction or patient's experience is now quite an old one, and in ordinary kind of colloquial terms, everyday terms, people tend to talk about patient satisfaction, and have done for years. But really quite a few years ago now, the serious researchers in the field, who started off at Harvard with Thomas Del Banco and Susan Edgman Leviton, and now are, I would say, matched by people in this country and elsewhere. They argued that there was a problem with the notion of patient satisfaction, which is that bound up inside it you have the expectation of the patients. And how do you separate out, if somebody says that they're very pleased with the service, their expectation, high or low, of what the service should have been like, and the quality of the service itself. And so they argued some time ago that experience was a much better way of measuring what happens to patients. It isn't to say that you rule out what they think of it or whether they're satisfied, but if you want to actually get information about things that you can measure and that you can improve, it's much more useful to find out literally, almost blow by blow, in some detail, what happened. How did the doctors talk to you? How did the nurses talk to you? What was the noise like? What was the food like? All those sorts of things, because those are things that you can do something about. Whereas if you say, how satisfied were you? And somebody says, very satisfied, what do you do with that information? The other problem with it is that there are quite large differences between patients' groups, between older people and younger people, for example, in their tendency to be satisfied, if you like. So what you would typically find is that older patients would say that they were satisfied with lower standards, and that's a problem, and it doesn't tell you much about the quality of care that's useful.
And your own work here at the King's Fund, building on, you know, what's been done in the past, etc. What's happening here, and what's that revealed at the moment?
Well, we believe that measurement is important. We believe that you can't really improve a service unless you pay attention to measuring it. You will not know whether changes that you have made are an improvement or just a change without some form of measurement. So we are keen advocates of measures and measurement. In our practical work with hospitals, we've found that a great many people don't know how to do this. That the arrangements to support measurement in hospitals, measurement of patients' experience, are much less well developed than the arrangements to support measurement of clinical quality. But that weirdly, people think that anybody can invent a question about patients' experience, and that's okay, and it's not. There's actually a long tradition of scientific research in this territory now, over 20 years, very good social science research, good psychological research, and there are good ways to ask questions and bad ways to ask questions, and good questionnaires and bad questionnaires, and there's no point doing this work to a poor standard. So the implications of that are that we think that healthcare organisations need to look much more carefully at the resources that they're putting into supporting measurement of patients' experience, and they need to work much harder at using the data that they get out of that to examine the service. I think my advice would be not to do it alone, but to seek help. I it's a difficult thing to do from a standing start entirely on your own. Most healthcare organisations will have someone somewhere in the audit department or in the information department, even in the patient administration department, with survey experience, and they may even be doing surveys already in the organisation. So the first thing I would do would be to link up with them and see what resources they have. My advice would be very strongly not to try and do it on your own, because it's a lot of work and there's quite a lot of detail in it. For example, it's not a good idea to give people questionnaires when they attend a clinic and expect them to complete the questionnaires then and there, because that may well skew the way that they respond to the questionnaire. They'll be aware that perhaps the nurse running the clinic will read this and that will influence what they say. Much better to send them confidentially a questionnaire at home at a different time, and all of that, as you can see, means administration, names and addresses on databases, making sure that you're complying with data protection rules, all of these things. So it's a complicated business, and I think it's not something to undertake entirely on your own, let alone thinking about how you would analyse the results if you haven't done this sort of thing before. The other place to turn, though, might be to look at your local nursing education institution. There's more than likely to be social scientists there with survey skills who could help. So I would say go down that route rather than try to become experts and do it yourself. But the other thing I think is that we shouldn't, although measurement is very important, we shouldn't, I wouldn't want people to go away thinking it's the only way of getting feedback. There are very good qualitative ways of getting feedback from patients about their experiences, which provide very rich data. It's not data that you can generalize from and say all our patients feel this or that, or had this experience or that experience, but it does bring tremendous insight into what it's like for patients and helps the professional to walk in the patient's shoes, if you like. So the kind of qualitative techniques that I'm thinking of are anything from simply finding a way to listen to patients' stories, to doing semi-structured interviews with them, either on the telephone or face-to-face. Ideally, it should be somebody, not the nurse running the clinic, who does the interview, so that the patient's not inhibited about what they say. Or getting a small group together in a sort of focus group, and perhaps finding somebody who's run a focus group before to help facilitate that, making a record of what people say and then reviewing that later. All of these are really rich ways of getting useful feedback on the experience.
Are there tools that people can use that are reliable, validated, that are out there? Because for a lot, we as nurses learn research, but suddenly we've got to do it. And I mean, your point is, don't do it on your own. Get somebody almost to mentor you and support you to improve the standard and help you grow. But are there things on the shelves they could use?
In the UK there are. The Care Quality Commission runs the national patient surveys, and there are national patient surveys mainly in acute care, but also in mental health services and some in community now, and in maternity. So there are standard validated questionnaires for those services. The national patient surveys tend to have rather long questionnaires. Many of the questions may not be relevant to a nurse-led clinic, that may go too broad. So I think it would be possible to take a sample of the questions, or to take a section of the questionnaire and to create a shorter questionnaire using the validated instruments. The important thing is not to invent questions, And also to get somebody who has got some expertise in questionnaire design to look at the questionnaire before you use it. There are some basic rules about the construction of a questionnaire which need to be followed. And the other important thing actually is that if you're going to use it with very large numbers of people, is to pilot it first, to have a short run through with say 5 or 6 people first, see whether it works before you go to the trouble of sending it out to tens or hundreds of patients.
And just finally on analysing it, I suppose there's 2 points: analysing it and dissipating it. With analysis, that can be fairly basic stuff, I would presume. You know, the number of pie charts, bar graphs. You don't have to be over the top with this, I presume, because if you keep it practical, you're going to get something that's of value to the team.
That's a really important question, and there's a sort of linked question, which is how did you sample the people who you sent the questionnaire to in the first place? Is it a randomly selected group of patients that's representative, or a consecutive group of patients, so you've sent it to all 100 who's starting on the 1st of November or something? It's more than likely that you won't need to go to do some fancy statistical work, as you're suggesting. Very important, though, that you know how you've sampled the patients and have made some good decisions about that. And I think probably for the sort of purpose we're talking about, as you say, fairly straightforward analyses which produce bar charts, pie charts that tell you about the proportion of patients in different groups would be adequate.
Is there any final points for people? I suppose just I mean, having a working knowledge of this isn't, as you said, there is a science behind this.
Yeah.
This isn't a case of taking Jocelyn's tips and just getting on with it. There's more to research and social science, etc. So read around the subject, get mentored. Or
Definitely, I am not a fan of the way in which people think that they can just make up a questionnaire and ask the patients. I think it's a waste of the patient's time, frankly, and a waste of the staff members' time, because what it will produce is not very good data that can't be compared with anything else. I think linking up to somebody who has it's not just a social science degree, it's actually experience designing and administering questionnaires, running surveys. That's really, it's a skill. It's an acquired set of skills, and it's a knowledge base to it. Lots of people have that in organisations, but I would say link up. There are some good things to read and good places to look. So I would encourage your viewers to look at the Picker Institute website.
How's that spelled? Picker
is P-I-C-K-E-R Institute. It's called the Picker Institute Europe, who they were the originators of many of the original national patient surveys in England. And they do surveys all the time, and it's just a website where you would find a lot of resources. Another name to look out for is the author Angela Coulter, C-O-U-L-T-E-R. She's written something with me here at the King's Fund about measuring patients' experience, which you can get off our website. But she's the author of a lot of very important papers and books in this area. So those would be two places to start.
Okay, thank you very much.
Pleasure.